Hi, I'm Dan Sulmacy, a physician and healthcare ethicist at the University of Chicago. Welcome to the Catholic Health Association's educational resource to help physicians better understand and apply the ethical and religious directives for Catholic healthcare services. The Catholic Health Association has developed this resource to provide an accessible and convenient way to learn more about the directives and how you can use them to address ethical issues that you, as a Catholic healthcare professional, may face. The directives provide guiding principles so that we always safeguard and promote the dignity of the human person in delivering our care. They are designed to help physicians, other healthcare professionals, and all who work in Catholic healthcare to carry on the healing ministry of Jesus in a manner consistent with the moral teachings of the Church. The directives were developed through consultation with bishops, theologians, sponsors, administrators, physicians, and other healthcare professionals. Periodically, the directives are reviewed by the United States Conference of Catholic Bishops to address new insights and issues that impact the Catholic healthcare ministry. This module is designed to facilitate both individual and small group learning. You may participate at your own pace, in one setting or in separate visits depending on your schedule. The module contains 6 parts which correspond to each of the 6 parts of the ethical and religious directives. Each part begins with an introductory video that features leaders in Catholic healthcare who share their insights and experience with particular directives. After the video, you can learn more about how the directives for that part apply by reviewing case study examples and answering a few questions. To make your learning experience as rewarding and productive as possible, we recommend you read the directives first. Now, we invite you to watch the introductory video for an overview of the directives and their importance for the Catholic healthcare ministry.
The ethical and religious directives are a very much underappreciated document. For some reason, people have this belief that it's this long, technical, complex, theological treatise, and it really isn't. And I think for most physicians, if they would read it and read it cover to cover, it would reaffirm many of the values that they hold already, the reason that they went to medical school, the reason they got involved in healthcare.
Physicians should read the directives because I think it really kind of reinforces this is why we're doing what we're doing.
I think ERDs are probably one of those hidden treasures that most of the physicians are not aware of.
It re-enhances what you're already practicing in day-to-day hospital and office care.
I think the ERDs are our way of saying, we're with you. We appreciate what you're trying to do. We know you take extremely seriously what you're doing, and we're here with you to provide the moral framework, the ethical reflections, so that you can do that with a peace of mind, a peace of conscience, a realization this really is the healing of God.
Today, Catholic hospitals, nursing facilities, and other healthcare organizations are continuing the healing ministry of Jesus within the complex, ever-changing world of 21st century healthcare. The ethical and religious directives for Catholic healthcare services, developed by the bishops of the United States in consultation with Catholic healthcare providers, offer assistance and guidance to the people who serve in these Catholic health organizations.
Healthcare has changed so tremendously in the past 40 or 50 years that we need some kind of guidance to help us to reflect about what we understand as far as the meaning of life, suffering, sickness, death, birth. And the directives are intended by the bishops to be a guideline to help us with that.
What we do as providers of healthcare is not just to cure the body, but also to give courage and strength and hope to the human person, so that people who are ill and who come to Catholic facilities searching for healing, we provide something more. They are not just a patient, they are a person with dignity, and a person with a divine origin.
These ethical and religious directives describe healthcare that is consistent with the values, beliefs, and commitments of Catholic faith.
When you open the directives, it's a mini course on Catholic identity in the world of caring for others, health care of others. The ERDs help us, first of all, restate our identity. Then they help us with practical guidelines in living out that identity. And then they remind us we're all part of a structured, visible church.
What the ethical and religious directives are doing is very succinctly saying what it means to be part of a Catholic ministry. But if you take a look at that, it's not simply Catholic ministry. What are the values of the medical profession itself?
And each section of the directives begins with pretty much a theological background from where are these directives coming from. And I always find those theological background to be so helpful and so focusing.
Grounded in these normative principles, the ethical and religious directives are organized in 6 chapters or parts. Part 1 addresses the social responsibility of Catholic healthcare organizations.
We're about healing. We're about preserving human dignity, human life. We're about making things whole and good. That comes right up out of who we are, and the norms come up out of who we are.
You want to try to help those that can't help themselves. And in doing so, you're doing exactly what you're supposed to be doing. You're doing exactly what Jesus tells us to do, and you're fulfilling that mission.
The care provided in Catholic health organizations goes beyond the treatment of physical disease or injury, recognizing also the psychological, social, and spiritual dimensions of the human person. Part 2 of the directives addresses this holistic vision with attention to the pastoral and spiritual responsibility of Catholic healthcare.
The pastoral care department, or the chaplain, is there to really assist the doctor in trying to name the emotional needs and the spiritual needs of the patient. Oftentimes it's the chaplain, in conversation with the patient and family, is able to bring to the discussion what those unique spiritual emotional needs are.
When patients come to a Catholic healthcare system facility, they come because they have a certain expectation. They have a belief in their morals, and they want to feel that the people that are providing the care have a lot of those same morals and beliefs.
Many physicians work in Catholic healthcare facilities who are not Catholic precisely because they find something there that they can't find in the other institutions.
Part 3 of the directives describes the nature of the relationship between patients and their physicians, nurses, therapists, and others who provide care. This sacred bond reflects the respect for each person's dignity that shapes the way care is provided.
My relationship with my patients is sacred. I'm allowed to touch people and to ask them questions about things that no one else is allowed to do, not even members of their own family sometimes. And that kind of a trust and bond works best if you remember that it's sacred.
You take care of a person, you're taking care of a patient, you're not taking care of a disease, you're not taking care of a lab number, any of those things. And along with that, you acknowledge their families, because their families are very important in their care. All of that adds to the dignity of the patient.
Respect for human dignity is central to Part 4 of the directives, which deals with issues in care for the beginning of life.
With the advent of new procedures and technologies, It's always important for the clinician in the Catholic healthcare system to maintain their focus upon the dignity of life and respect for the individual. The ethical and religious directives inform Catholic healthcare as to the importance that the Church places upon human life and the sanctity of human life, as well as relationships.
So what I think is most interesting about Part 4 is that it talks about the meaning of marriage, the importance and meaning of the marital act, and how the unitive and the procreative need to be there.
The directives also give guidance in the rapidly advancing world of new technologies and procedures.
For a doctor to say, what am I going to do here? And to know that he or she has enormous possibilities because of all the things medical science tells us we're able to do. The ethical and religious directives help answer that second question. What should I do?
Because we deal with issues right at the very limits of viability often. It's very helpful to be able to just look back and make sure that I'm remembering exactly what it is that I thought it said, and I usually have it right, but it's nice to have it right there as a reference and as a guide for helping to make those kinds of decisions.
Like care at the beginning of life, care provided to those who are critically ill or at the end of their lives must also be grounded in reverence for human dignity. Part 5 of the directives treats issues in care for the seriously ill and dying.
All of us should be graced with a death that is humanly dignified, that is marked with Christian dignity.
We recognize that life is a gift from God, that it is a gift freely given without our asking for it, without our worthiness, and that because this is a gift from God, and God is the one who gives life, God is also the one who takes life and takes us to himself.
Death is inevitable for all of us, and so we have to be able to effectively deal with patients who are in the dying process. We have to allow them to share in the decisions that are being made about this process for them.
There is a death, but it's not the end of life. There's the beginning of the eternal life.
Catholic health organizations are caring for persons from life's beginning until its end. They carry on the ministry of healing while confronting contemporary business and ethical challenges. Part 6 of the directives explores the issues facing the ministry when forming new partnerships with healthcare organizations and providers.
We have to engage people and others that we may not have had a close relationship in our care delivery models, and that's physicians, and it's home health care agencies, and it's long-term care agencies, and so on, and they're not all going to be Catholic. There's no way that they can do that. So I think that the ERDs give us some guidelines of how we should approach those partnerships.
The beauty is in challenging us to create partnerships so that we respond to the needs of our society and the needs of those in our community, that we create partnerships about the more, that we create partnerships to treat those who are on the margins, those who are poor, those who are the 48 million or however many million of uninsured that we have in our day. You know, it's just plain unjust.
The directives are there to ensure that as we go about the business of healthcare, we're also always involved in the ministry of healthcare.
Taken together, the ethical and religious directives are a rich, affirming resource for the people who serve in the Catholic health ministry. Far from a mere set of rules, the directives present a vision of true healing, and they help ensure the identity and integrity of Catholic healthcare.
Often I get questions from doctors where they're making assumptions about the ethical and religious directives and what they can and can't do. Then I'll show them my copy that I keep on my desk and point out to them those directives that pertain to their particular question, and they're often surprised.
They're not there as a club over the heads of docs. They're there as a support for the work of physicians. They're not only a help for Catholic healthcare to remain Catholic, but they're a help for physicians to remain true to their art.
What they do for health providers is to anchor them within a particular heritage of faith, a heritage of faith that stretches back 2,000 years from that time when Jesus himself touched and healed and comforted those who came to him for help.
You know, Jesus said, I was ill and you healed me. You know, what else is there to say? That says it all.